It's 8:15 p.m. Do you know what your money is doing? I'm not asking you if you know where your money is. I'm asking if you know what your money is doing. Okay, all right, you are not alone. It's a common thing, right? You just want to see that your money is generating returns, and I mean, that's it, right? But it comes a time when you really need to know exactly what the money is doing. That's what I'm going to talk about today. Focus on health. So, when you think of Wall Street, you think of billions of dollars really moving swiftly across screens and really glowing terminals, right? But Africa already has its own Wall Street. It's invisible, silent, reliable, and really enormous. About $100 billion every year. It's the money that African diaspora send home. Not on trading floors, but through mobile money and bank wires, remittances. Despite the fact that this is an enormous sum of money, they are still financing gaps in healthcare that we cannot ignore. So, when you think, if you look at the screen, when you think of the $100 billion in remittances, to achieve universal health care, right, we need $15 to $25 billion just to fill the gap, right? Remittances mostly support household spending while hospitals remain unfunded. So, what if just a fraction of this $100 billion was allocated into health security buckets using approaches similar to those used on Wall Street? That's exactly what the Global Health Catalyst is doing, building the African Health Bond Exchange, ABEX, that is part of the Global Health Bond Exchange, GLOBEX. So I'm going to talk to you about that. I hope you've seen the screen part. Good. So, imagine a financial marketplace that is like a Bloomberg terminal meets NASDAQ, powered by transparency, C4AI Comprehensive Cancer Center in the cloud, that's what I mean, and blockchain. And instead of trading oil or trading Nvidia stock or trading Home Depot, you're actually tracking key performance indicators or impact policies in health, like early cancer diagnosis, a percentage of time that PET-CT scanners are operational, right? Like treatment completion, like psychosocial support, or oncology workforce training, retention, and service expansion in African, urban, and rural communities. So, how does this really reach a patient? Okay, here's an example. On the screen, you see Diaspora Invests, a health bond fund's PET-CT scanner. Sarah gets screened earlier, changing her odds, and capital becomes care. Now, let's zoom into one of the key performance indicators that we really track. So, fund diagnostic capacity and or prepaid screen, and you raise early cancer detection by 20%. That's not abstract. It is mothers, fathers, and children's lives saved. Now, what makes this cycle work? First, it's the African diaspora. You see, motivated by love for family, over $100 billion moves yearly from diaspora hubs to Africa. You can see all the hubs. With ABEX, a fraction of those inflows are set aside in transparent health security buckets. And here's the beauty of the African Health Bond Exchange. It's not just about the diaspora. Everyone is involved. So diaspora brings capital. Clinics, faith-based organizations, and hospitals deliver care. Governments and finance partners provide stability. Around it all, C4AI verifies impact and blockchain secures trust. Together, the system works. Wall Street delivers returns. The ABEX delivers returns plus proofs of life saved. That's why I asked you if you knew what your money was doing. All right. This is what we are up to. We have to show people what their money is doing. So, after a win-win negotiation has been signed, how do we turn promises into proof? I'll show you. So, key performance indicators like the ones you're seeing on the screen are written into blockchain's smart contracts. Then C4AI collects only those metrics from clinics, faith-based organizations, and hospitals, then checks the cost of the outcomes and then attributes the gains directly to the bond or voucher-funded action. So diaspora and donors know what exactly moved the needle. Then publishes a signed key performance indicator card that smart contracts read to automatically trigger transfers from an escrow bank account to pay service providers and investors who actually funded the intervention. So, we also see that there is a unified dashboard that shows exactly the capital that went in, the service that was offered, right? The verification, and then the payout. So, this is automatic payment that is done to show exactly proof of what the money is doing. Now, you may ask, if ABEX is a marketplace and so how often do we see these signals, right? Here's the rhythm. Okay, these are pulses. Every week, right, the dashboard shows fast signals like machine uptime, voucher redemptions, patients onboarding. Every month, we publish verified outcomes, early diagnosis, treatments completion, psychosocial support. These are just examples, right? And every quarter, we issue an impact pulse report. This is like an earnings call on Wall Street, except market sentiment rises and falls with lives saved or disability-adjusted life years averted. So weekly for speed, monthly for trust, and quarterly for strategy. Now, let's see how market participants actually respond when the signals turn bullish, neutral, or bearish. When signals flash bullish, like early diagnosis is up 58%, or treatment completion is up 90%. Diaspora and impact investors love this. They lean in, demand for bonds and vouchers grow. And for policymakers, donors, and philanthropists, it's a sign to really expand funding and to replicate the model because it's working, so it can be replicated elsewhere. Now, when signals hold neutral, like PET CT uptime steady at 85%, investors stay calm, but governments and donors may step in with catalytic support to push performance higher. And when signals turn bearish, like psychosocial support, dropping by 47%, private capital pulls back. Someone has to step in. Philanthropists and donors move in order to stabilize the system. This is blended finance in action. So different participants stepping in at different moments on the impulse path and doing different actions, keeping the market really dynamic. That's what it is. And it's not being done in isolation, all of this. So the ABEX is woven into Africa's health and trade agenda, aligned with African Union, WHO, Africa Continental Free Trade Area, and Africa CDC. And because of that alignment, it has the staying power to scale. For example, this curve shows Uganda's path with ABEX. A pilot starts at the Uganda Cancer Institute. Over 10 years, every dollar mobilized and capitalized through ABEX doesn't just stay in hospitals or clinics, it multiplies through the economy, adding about $1.50 to gross domestic product. That's the power of compounding health and trust. Here's how. When a patient like Sarah is diagnosed earlier, they stay in the workforce. When we build digital health platforms, they ripple into broader digital transformation. When diaspora invests with confidence, that trust draws in even more private capital, facilitates the development of supply chains, local manufacturing, workforce training, and research initiatives. By year 10, the economy is nearly 9% bigger than it would have been without ABEX, relative to Uganda's latest baseline gross domestic product. ABEX is not just about saving lives, it's about unlocking economic growth. But that growth curve only bends upward because we start now. Looking across Africa, here's why we can't afford to wait to mobilize capital to fill the health financing gap. On the left, you can see the cancer and non-communicable disease crisis. Every year we delay, the curve keeps rising, and with it, lives are lost. On the right, you see what delay does to economies. If we start now, economies bend upward. But if we wait, economic growth slips. That gap that you see right there represents billions of dollars in lost economic potential. So, the cost of waiting is double. Each tick of the clock means more lives cut short and more economic growth left behind. The choice is simple. Act now or pay twice the price later. We've seen how Sarah's story shows what's possible with ABEX. But what does it mean for the diaspora family member abroad sending money home every year? Take a Ugandan abroad sending $5,000 a year home for household needs. They decide to set aside 20%, that's $1,000 of their remittance, into health security buckets on the EBEX over a 10-year period. That transforms short-term household spending into long-term family protection, leverages their funds 2 to 3 times through co-financing, and leaves a measurable legacy of cancer equity and economic uplift. So, over 10 years, that's $10,000 that earns predictable returns is matched 2 or 3 times, becoming $20,000 to $30,000 in cancer care financing. And unlike the other 80% portion of the remittance, this is traceable. Now, this Ugandan knows what their money is doing. This is diaspora legacy. Here's your invitation. Wall Street creates wealth, but through the African Health Bond Exchange, together we can create health, the greatest wealth. We've seen how one diaspora family's remittance can become a legacy. Now imagine millions multiplied by governments, donor-advised funds, impact investors, philanthropists, innovators. That's ABEX. Merging health data with capital market logic to democratize capital and insights. And tonight, I invite you to join us as stakeholders to build the Wall Street of Health for Africa. Transparent, trusted, and life-saving. Join us.